Hello again. I'm here to share another blast from the past with respect to evidence for health equity. My vlog is not a personal story, it's a story of the people of Senegal. And it comes from a project I worked on several years ago when I had the privilege of working for IDRC, a Canadian research funding agency that is committed to strengthening equitable health systems through evidence. This is a story of corruption in the health sector. It's a story that defines and then later questions who is a villain and who is a victim. It's a story that uncovers inequities in governance that lead to inequities in health. So let's start at the beginning. Petty corruption had been well known and widespread in Senegal's health system for many, many years. With high-level political support and in the general political climate of the time, Forum Civil, the Senegalese branch of Transparency International, was able to launch a multidisciplinary research project to examine corruption in the health system. The study took place in 6 villages and examined a range of hospitals and other health facilities. The study revealed a pathogenic governance of health structures, featuring profound distortions in the hierarchy and the system of control. The result was that the health system operated through informal networks based on personal connections rather than clearly delimited roles and responsibilities. The results were controversial. They implicated a range of players in the health system, and so Forum Civil resorted to the media. A slew of cartoons and caricatures sprinkled the local newspapers. The plight of patients was made visible. However, while the media portrayed patients as victims of corruption, there was backlash from the providers indicating that their requirements for provider fees stem from delayed salaries, insufficient equipment, and other structural challenges. Stockouts was another example. The villains were therefore able to demonstrate their perspectives and resulted in a groundswell movement by the government to institute reforms to benefit patients as well as the providers. Everybody was a victim in this particular system. A system of accountability was established, and attitudes towards patients were altered. This story shows the power of the media in its ability to provide voice to the voiceless. It demonstrates the importance of multiple perspectives so that the plight of all those concerned and are understood and shared. It can shape political as well as social action through emotive graphics and language, and media provides a platform for civic engagement. As we think about equity for global health, let's harness the positive power of the media to advance the credible and balanced evidence for health equity.